For the past 15 years, government, along with its development partners, made several interventions to reduce the burden of HIV, but the impact of such interventions on the population were largely not assessed. Now, a survey called Namibia Population-Based HIV Impact Namfia has been launched, which targets over 25,000 participants and will run in phases, of which one would require HIV testing of patients. Participation is voluntary, but Health Minister Dr. Bernard Haufiku appealed to the public to take part.
This survey is completely confidential. No disclosure to a third party. No revelations. So be assured that this is the case and it will remain so. The study is carried out by well-trained, well-experienced healthcare professionals who are in charge of the survey, and nobody else and nobody knows who's HIV positive except the candidate themselves. But even then, they are informed in the most professional manner and they are referred into care for those that are not already in care.
The survey will help the Ministry of Health and Social Services to establish whether it is on track with its HIV interventions and where it needs to shift resources in areas where there is an acute need. Namibia needs to meet several targets, such as the United Nations ambitious 90 targets of achieving 90% on diagnosis, treatment and viral load suppression to end HIV by 2020, getting to zero, and elimination of mother-to-child transmission.
But we still need more information. To cross that last gap between where we are and fully achieving the 90-90-90 targets. In other words, for the last and what is going to be the hardest part of the journey, we need to use the power of more detailed data. We need more information because there are still things about the epidemic that we do not know and that we need to know.
The survey has several partners on board and will run between 8 to 12 months at different phases.